You're listening to Sorry for Asking.
Sorry for asking. I'm Cole Connor.
And I'm Adam Ramzi. This is where we talk shop, ask questions,
Tell stories and laugh some laughs about being creators.
as well as consumers of adult content. We love watching too.
We certainly do. We also discuss the impact adult films have had on us
On our guests.
and on the LGBTQ community.
So strap on and strap in.
And here we go. Hey, welcome back. I'm Cole Connor.
Hey, I'm Adam Ramzi.
And you're listening to Sorry for Asking.
Sorry for Asking. Hi, Cole.
Hi.
How's it going?
Great.
Yeah?
Yeah.
Good day today?
Look at us. We just decided, both of us, to show off the guns today because
why not?
I did my buys and tries
Yes,
today.
yes,
Yeah.
yes. I've had a good workout week. I had to take a little break because I had some back issues, but I'm like feeling good now.
Oh.
We're like well into spring. Things are good.
Spring. We have we have a lot to talk about today.
Today's a big one, y'all. Today's a big
So-
one. I'm excited and even a little nervous. But yeah, we have a very special guest today. Do you want to introduce him or should I?
We have our gay urologist,
And sexual health specialist, the
Dr.
one and only Dr.
Josh
Gonzalez.
Gonzalez.
Hey guys, how are you?
It's good to see you, Dr. Josh.
It's good to see you too.
What's
Glad to be back.
What's it like to be our first returning guest?
Yes.
Oh, I didn't realize I'm the only
The
returning
only
guest.
one.
Wow.
Yeah.
I feel honored. Thank
Yeah.
you.
Yeah, no, our first episode is one of our highest rated.
Really?
It is one of the ones that I certainly have listened to multiple times, and I will listen to again because it was so dense and full of information.
very dense.
For those of you who are new to Sorry for Asking this season, if you go back to season 2, there's an episode with Dr. Gonzalez where we talk a lot about one of my favorite subjects in the whole world,
Wieners?
wieners.
Wiener health.
Wieners and health.
Yeah.
Wiener health. Yeah, it was, and I've heard actually from a lot of other people too that they listened to it multiple times.
Great. Yeah.
When I've told people that we're having you back on, people have been like, "Oh my god, I learned so much from that episode."
It's true. I mean, it was insane. Like, and you know, I do all the editing on these episodes.
Yeah.
That episode, I didn't do a single edit because
wow.
it was just beginning to end so much information, and you have so much to share with us and teach all us homosexuals about how to take better care of our bodies.
Exactly. That's my mission.
I feel like it's the straight ones that need the help.
I mean, it's really everybody. Like, this is the thing, and this is going to be, you know, just a little preview. Like, I feel like a big part of why we do this and why you do this, I would think, is because people don't talk about this stuff as much as they should or could, or, you know.
Yeah, totally. I mean, I think you guys are in a unique position with the nature of this podcast and talk about sex a lot, but there are a lot of people that are misinformed, get bad information, and don't feel comfortable talking to doctors about this kind of stuff. And it's super important. It's a big part of your health.
Yeah.
Like, I got an Instagram DM from someone that was like, "So when I start taking Popstar, do I have to stop jacking off for 2 weeks?" And I'm like, "No. Why would you even think that? It's so like the things that people
Jack
create
away.
Right.
in their head
Yeah.
is
Yeah,
like
it's funny.
is funny."
And as a reminder to our listeners, Dr. Gonzalez, can you tell us what Popstar is?
Yeah, totally. So Popstar is a ejaculatory health supplement that increases the size of your loads, which in turn can increase the intensity of your orgasms and make sex funner.
And tastier.
And tastier,
Yeah.
yes.
Why don't we go ahead and hear from that sponsor right now?
Sure, we'll go. We'll just get
it out of the way.
that right out of the way. And there you go. That was Popstar. You guys have heard that before, but now here we are with the person responsible for Popstar, which is Dr. Gonzalez. You know, there's like a few things, and somebody was telling me recently that they went on Amazon to buy something called Pygium.
Pygium. Yep.
And I actually, when he told me about it, he said it was because it gave him bigger loads, and I immediately grabbed my Popstar bottle and looked on the back to see if it was one of the ingredients.
Yep.
What is Pygium?
So it's from like an African tree bark,
Okay.
and it's like a natural ingredient that for whatever reason, is just known to increase ejaculatory volume. It was mostly studied in the reproductive literature, so that's kind of where that comes from. But it's just essentially like nature's way of giving us bigger loads.
We love that.
Yeah.
What are some of the other ingredients that you have added to Popstar?
So the 3 main ingredients that increase the volume are L-arginine, pygeum, zinc. And then the supplement also has bromelain in there to sweeten the flavor, because why not sweeten it if you're going to make it bigger?
Obviously, I'm sure everybody, like probably a large percentage of listeners are thinking, oh, does bromelain come from pineapples?
It does.
It
Yes.
does.
I was
cool.
thinking pineapple extract.
Yes. Yeah. So it's one of the enzymes in pineapple.
Nice.
And that's where the whole, if you eat pineapple, it makes your cum taste sweeter, legend comes from. The reality is you would have to eat like truckloads of pineapple to make that happen. So we just concentrated it and put it in the supplement. So you just take 4 pills a day. That's all you need to do.
I don't think we brought this up last time. A friend of mine once told me that celery is also very good at helping with, I don't know about the taste, but at least the volume.
Yes. So celery, we think primarily because it's mostly water. Yeah.
Okay.
And so hydration, in addition to taking our supplement, hydration is a really important part of maintaining your ejaculatory volume. So that's why with the supplement, we recommend that people take it with 16 ounces of water.
Cool.
Yeah.
Yeah. Okay. Well, before we get into further discussion, how are you doing and how are things lately?
I'm good.
Tell us about.
Yeah, so I'm doing really well. In November, we moved my practice from the old location down the street to a new office. We just had a grand opening last week to celebrate
I was
that.
super bummed I couldn't go because I had to shoot a scene for Raging Stallion on that day.
Yeah.
The same fucking day in Palm Springs.
It's okay. I went to represent for us both.
You guys were represented, but we did miss you. So the office is, we finally feel kind of settled into the new space.
It's a beautiful space. Congratulations.
Thank you. Yeah, and I've hired a nurse practitioner and a PA that work with me. So we're just growing the practice and really just trying to diversify the kinds of patients that we see and the kinds of issues that we help people deal with.
Yeah.
Yeah.
And Cole and I both, we are not only your friends and your Popstar clients, we have now also become your patients.
Yes.
Which has been really exciting. Is that okay to talk about?
If you want to talk about it, yes.
Doctor-patient confidentiality.
Yeah, exactly. Exactly.
Yeah.
I think it's up to us.
Yeah.
Right?
Well, I guess I just outed you. Is that okay?
How dare you?
How dare.
I feel so violated.
I feel like I'm in really good hands. I'm very happy to be coming in there, but I don't want to...
Literally.
Yeah, like, yes. Yeah. Well, congratulations on the new space.
Thank you.
And hope for much success there. And I wanted to talk today not specifically about dick health because we did a lot of that in the first episode. Unless you have more to add, if there was anything.
There's always more.
There's always more, of course.
Yeah.
I'm sure if any questions come up throughout this episode, we will ask. But I kind of was very interested in focusing today's episode on hormones.
Great. Yeah.
Because I didn't know until recently that is also one of your specialties. Mm-hmm. Can you tell us a little bit about that?
Yeah, and I actually put the whore in hormone.
I'll put the moan in hormones.
I've heard that. So hormones, I think some people know, but maybe not.
I'm going to guarantee you that most people don't.
Okay.
Tell us about hormones.
I am a sexual health specialist.
Great.
Hormones are probably one of the most important things when it comes to your sexual health. There are a lot of reasons why people's hormones can get screwed up. Sometimes, they decline with age. Certain medical conditions can cause you to have hormone deficiencies. And so that's one of the first things that we do if someone comes to see us with, some sexual problem, erectile dysfunction or low sexual desire, or even things like fatigue or brain fog. Those can all be symptoms of low testosterone or some other hormonal deficiency. And so it's just, about doing some blood tests and kind of seeing where things fall. And if things are not in an optimal range, then we talk to patients about how they can kind of optimize those issues.
Optimize. That is a word that has been like optimal and optimization. These are words that have just been like floating around me lately. Like even let me go back a little bit to dick stuff.
Oh, okay.
Because, for example, as we get older, and I think that this is kind of related to hormonal stuff, I'm guessing, there are multiple factors that I think go into the way we work in terms of optimally. And I'm guessing that is stuff like hydration, rest, mental health, diet and exercise.
Yeah.
Let's see what else. I have like vitamins and minerals.
Yeah. Well, here's the thing. What your doctor has always told you to do for your overall health is exactly what you should be doing for your hormone health and your dick health, right?
Okay.
So when, you hear providers talking about you need to get, good quality sleep, 6 to 8 hours minimum, right?
Yeah.
You need to be eating a well-balanced diet. You need to take care of your mental health. Do what you can. I mean, stress exists. It's not going away, but do what you can to try to minimize that, or at least find healthy ways of coping with it. Not overly consuming alcohol, avoiding things like tobacco. Like, those are all things that your doctors have told you for years, right, to do for your overall health. Those are all things that will help your body continue to make healthy amounts of testosterone, continue to have good blood flow, which is super important for things like erections, and allow your body, from a sexual standpoint, to continue to function well.
Yeah, I'm a big vapor. I am ashamed to admit. And
I always give him shit about
he gives me shit about he has in the past.
I'm always like, vaping is trash.
It is a little trashy. I can't help it. I have an oral fixation. What can I say? And it just gives me a little something to do.
Yeah.
But somebody once kind of told me, they like came in where I was hanging out somewhere and I was vaping, and they were like, that affects your boners, right? And it like killed me.
Listen, it's the nicotine or the other shit in it?
Yeah, I mean, there's not like a ton of data on vaping and erectile dysfunction just because it's kind of a relatively new thing.
Sure.
But yeah, so it's the chemicals, and specifically in cigarettes, that definitely cause problems with your cardiovascular system. And we think to a certain degree, maybe a little bit less so with vaping, but there is the potential for some effects on the cardiovascular system. And that's what this whole thing is about, right?
I see. Okay.
If you're fucking with your blood flow all over your body, it's definitely going to affect your erections.
Right.
Yeah.
Right.
Can I say fuck?
Yeah. You could say fuck.
Please.
All right, great.
So what are some of the services that you provide to help optimize hormonal health?
Yeah. So I guess let's talk about optimizing, right? So
Yeah,
I don't
love
think,
that word.
I like that word because I don't think it's helpful when you're talking about sexual health and sexual health problems to label someone as normal or abnormal. And that's a really important distinction, especially when you're talking about hormones, because the range, let's just say testosterone, for instance, right? The range of testosterone is very wide. And the reason for that is that it's meant to kind of encompass a normal range for men starting at puberty until they die.
What is the considered normal range of testosterone?
Yeah, so it varies by lab, but in general, let's say like 300 to 900, right? Nanograms per deciliter. And so if you're using that, and you're a guy in his 20s or 30s and your testosterone is 325, right? That's normal, but it's not going to be optimal for a younger man who is coming to see me with low desire and erectile dysfunction and some of these other low T symptoms. So that's not a person that I'm going to turn away and not offer them some treatment to improve their testosterone. And we know that testosterone declines as people age, and historically it was thought to be a problem of older men, but we're finding more and more that guys in their 20s and 30s are coming in with symptoms of low T, and then we check their testosterone and it's lower than one would expect. That might be because of, lifestyle factors like we just talked about. That can be from environmental factors that are out of their control. It can be from genetic factors or other comorbidities. So there's lots of reasons that even younger men can have these issues.
Is it more in like the US or is it all over the world?
I mean, we're seeing declines in male sexual function globally. I mean, that includes testosterone levels, increasing rates of erectile dysfunction, declines in fertility. So this is a global problem. A lot of that is probably related to our environment and stuff that, even if you're trying to be as healthy as possible, there's things that are unavoidable. And so so that, that's the main theory as to why globally male sexual function is on a decline.
It's just the decline of human civilization and society. And
exactly.
As a species, we're just going downhill.
It's all
that's what's
just
going to happen.
TikTok's
starts
fault.
with the dick.
Yeah, it is.
It's TikTok's fault.
The dick is the sort of canary in the coal mine, right? It's often the first thing that men notice a problem with, right?
Yeah.
Because if you're not able to have sex, you're like, what the fuck's going on? And then that can lead to, well, you're actually, have undiagnosed cardiovascular disease, and maybe you should be screened, have your heart screened, and there's other tests that can be done, and sometimes ED is the first thing that comes, to someone's attention.
Yeah. Can I ask you, what are some other symptoms of low testosterone?
So the big ones are low desire, fatigue. We see that a lot. Guys just coming in saying,
Just tired all the time.
Tired all the time. They feel like they have to take a nap in the middle of the day when they didn't used to. They don't feel motivated to sometimes get out of bed. Maybe they're not seeing the same gains that they would expect at the gym, despite, doing, the same kind of exercise routine that they've been used to doing. Difficulty putting on muscle, storing body fat when they wouldn't expect to. And then there's like a bunch of cognitive stuff. So like trouble remembering things, brain fog, kind of not being able to find words, depression, anxiety, erectile dysfunction. So there's a lot of different symptoms, and sometimes it can be really subtle. And again, if this is happening to a younger person, they might have some shame around that and not understand, or think there's something wrong with me and I don't want to talk to somebody about it. Or maybe they have talked to someone about it, and someone, they might go to their primary doctor and say, I'm having problems performing in bed or whatever, and just get dismissed as oh, it's just all in your head. It might not actually be in their head. It might actually be a hormonal issue or a blood flow problem or something.
Right.
Yeah.
So.
And I feel like people go straight to Trimix now and Bimix and everything. And
Oh, sure.
And so then you're like, well, I fixed the problem.
Right.
Because that's going to work.
Yeah. Yeah. Well, it doesn't actually work for everybody, but I mean, I think depending on what kind of, community you're in, what your access is to those kinds of medications, people do sometimes just jump to that, or maybe they have a friend that's already using it and they just borrow their friends. But that's not really understanding what the problem is, right? Mm-hmm. If you have a real vascular issue, that's probably something that's important to know, because again, that might be the first symptom of a global problem, right? You might have a cardiovascular issue that needs to be diagnosed, and it's not just confined to your penis.
Right. So TRT, is that, can you tell us what TRT is?
Yeah, so that stands for testosterone replacement therapy.
Okay.
So that is one option for men that we diagnose with low testosterone. And there's pros and cons to putting someone on testosterone replacement therapy. So the way I like to think of it is, if somebody has low T and is symptomatic, right, we have to talk to them about ways to get their T higher. Those include testosterone replacement therapy, and there's a bunch of different ways to do that. We can talk about that. And then there are what we call fertility sparing or testicular preserving medical therapies that basically stimulate your body to make more testosterone. And so for younger guys, or guys who are maybe interested in having a family at some point in the future, we often will choose that latter option to try to stimulate their body to make more testosterone, so it doesn't become reliant on this exogenous form.
What are some methods to do that?
So there are the two main ones are a pill called clomiphene, which is essentially a pill that stimulates the pituitary gland, which is the regulatory center in your brain.
I see.
And then that sends kind of an amplified signal to your testicle, telling it to make more testosterone.
I knew that.
I've taught you well.
Taken it.
And then there's another medication called HCG, which is an injectable, and that sort of bypasses the pituitary gland and directly stimulates the testicle. Both work very well. There are some things that we can see in your labs that might predict that you respond better to one versus the other, and both are primarily used in fertility. So they both, because they stimulate the testicle, they improve sperm production, right? So that's what their primary use in medicine is. But the one of the other consequences is that your testosterone also goes up.
that is a consequence, you said?
Well, a good consequence.
Oh,
yeah.
I see.
Yeah.
Okay. All right. Are these ever used in conjunction with testosterone?
Yep. Yeah. So if I have somebody who, I don't know, just clinically, I think probably would do better on testosterone replacement therapy, but may want to do whatever they can to preserve their fertility and their sperm production, or are really worried about things like testicular atrophy, because that can happen
small balls.
Yeah.
Your balls can shrink when you're on testosterone replacement therapy. So some guys are really concerned about that, and that we can pair TRT with HCG or Clomid to try to preserve some of that function.
God, it's so complicated.
It's a little complicated.
I gotta ask this too. Is this kind of a new science?
It's not a new science. I think it's becoming people are becoming increasingly aware of it, because there's so much greater interest in things like longevity and optimization, right? People want to do whatever they can, especially in a place like LA, right? Like, people are, in general, I think, trying to be as fit and healthy as they can be. And so there's just like a million clinics that have opened up that do hormone optimization, and so I think there's a greater interest, but the science is not new. This has been known for a while.
But it's like the nature of putting something foreign into your body, and creates side effects.
Absolutely.
Yeah.
Like anything is going to create
And
some
you know,
kind of side effect.
and we're going to get into that definitely. But before we do, I want to ask, like, what would you say to a skeptic? For example, you know, like you said, we're in LA. A lot of us here are about wellness, but we're also about preservation. We're also about looking younger and feeling younger. What would you say to a skeptic that would put this in one category versus the other? What, like, if you were to say, like, no, testosterone replacement therapy is about wellness and about health.
Yeah.
And someone would say, no, it's really about muscles or youth or, you know, like.
I would say that both things can be true at the same time.
Love that answer.
So I learned a lot in therapy.
Oh, boy.
Yeah. So both are true. I mean, yes, testosterone does help you build muscle, but it also helps you be able to continue normal cognitive function. I mean, what I would say is no one bats an eye when a doctor wants to put a patient who is insulin resistant on insulin, right? No one would question if a doctor wanted to put someone on thyroid medication because their thyroid was no longer producing it. Your balls were not meant to live past 35 or 40, and so they can't produce the amount of testosterone that our bodies need to function in a healthy way.
Yes.
And why should we not provide men the ability to continue to lead healthy lives by just giving them methods to have healthier testosterone levels? I'm not saying, you should be getting it from your trainer or some back alley clinic. Like, I think you should go to a professional who knows what they're doing, who has specific training that, like I do, in sexual health, in hormone health, so that you don't have side effects. But it's silly to me for when people kind of equate testosterone replacement therapy with vanity or, like you're saying, bodybuilding.
Of course. Well, I mean, this is part of why I asked you if this was a new science or not, because I'm in my 40s now, and I only started hearing about TRT in the last few years. What I've heard for about a lot longer is steroids. Yeah. And that is, I kind of want to talk about that a little bit, because I feel like I've been hearing about that since I was a teenager. Yeah. That, like, oh, look at his muscles, he's just on steroids. Right. What I didn't realize was that steroids really, actually, like, why don't I ask you this? What even are steroids?
So when we say steroids, we typically are referring to anabolic steroids, synthetic hormones, essentially, that are, kind of stimulating your body to build more muscle, right? And often what people don't appreciate is that steroid, regimens will often have testosterone included in them, but then there's a bunch of other stuff that you stack on top of that.
Okay.
And that traditionally has been for bodybuilding. That is not what I would consider what someone is doing for, like, maintaining their optimal health. That's very specifically for bodybuilding, and there are some consequences that can come with that. We see patients in my office all the time who develop sexual dysfunction because of their steroid use. Yeah. Which is a little bit counterintuitive, because many of those men have testosterone levels off the charts high. And people incorrectly assume like, oh, if your T is like 3,000, you must be like,
the
horniest person and have like a raging heart on all the time.
And that is not the case.
That is not the case. No. Some people have that response. But other people can have the complete opposite. Sometimes they can't get hard. Sometimes they have absolutely no sexual desire. And we don't fully understand why that is the case. What I can tell you is that, going back to that normal range of 300 to 900, our bodies were meant to function within some sort of normal range.
Right.
And we've done our best to kind of estimate that at 300 to 900. But people have problems when their testosterone is below that. And people have problems when their testosterone is way above that too.
Do these anabolic steroids also affect your testosterone levels, or are they specifically designed to do other things within the body? Yeah,
so it depends on what specifically you're using, but many of them are they're meant to build muscle. And they stimulate your body to basically make more testosterone, and many people are also using testosterone on top of that. So
why would they have to go hand in hand?
That's a good question. I don't know the answer to that. I just know it's pretty routine that people. I think you should think of it as sort of like testosterone is almost always part of the steroid cycle, and then things are stacked on top of that to drive it up even higher.
I see.
Yeah.
Okay.
I thought like testosterone was the vehicle for the steroid to like do its thing. I don't know.
That's
that
an interesting way to put it.
The steroid alone would work. Yeah, they're meant to be.
Okay. Gotcha.
That's why they call it.
What are some of the negative effects of having super high testosterone?
So some of the stuff I just mentioned. So like erectile dysfunction can happen, low desire can happen, and then there's this whole thing about like post.
See, it's funny those are side effects of low testosterone.
Exactly.
So isn't that funny?
It's like a tipping point,
right?
And then like you're like going up, and then
like a
too
bell
much
curve.
takes you down.
Yeah, and it can actually be pretty challenging to help those men recover. A lot of men who kind of dabble in steroids, especially at the beginning, may not know about like post-cycle recovery, right? So some people will do like a steroid cycle and then they just stop everything and then they feel like shit. Even if they were feeling okay on the steroids, then their testosterone plummets and they feel terrible. And so it can be challenging to help those guys recover. We have to often put them on medications like HCG to really try to maximally stimulate their body to produce testosterone again.
I mean, I'm going to get into what I've experienced, certainly. I mean, I've come into your office to talk about this. But like, I also, just from somebody who has not gone into the world of hormone replacement specifically to look bigger, I notice some guys who have, first of all, a lot of acne on their skin. I want to ask about that a little bit. I also notice some guys who go really far with it, where it looks almost like their skull is trying to break out of their face. Like it's just is bone density actually increasing?
Yeah, I mean, there's just so many different things that people use. It's hard to say from one person to the next like what's going on, but in general, like guys who are on steroids often will be producing more oil in their hair follicles and their skin, so that is one reason why they can get acne. There's also this like kind of red hue that men can develop, and sometimes that happens actually just even from testosterone. That may be some effects that it's having on your kind of microvasculature. The like big head thing, I'm not sure what
you know
that
what
is.
I'm talking about,
Yes,
right?
I saw that on an Instagram post the other day. Like
I totally understand.
I was like, no, I'm thinking about it.
Yeah, I mean, so another thing that people use is human growth hormone, and that causes tissue to grow. That's what that hormone does. And so I would have to think that maybe some of that facial stuff is related to that. But it's hard to tell because sometimes people are using things that they don't even know what they are. You know, like their buddy or their trainer or somebody told them to do this and to just get bigger, and they do it without really questioning.
Yeah, of course.
What is the difference, and what do you think is better? I mean, I don't know if better is the term, but like there are people that take HGH, human growth hormone, and swear by it instead of steroids. And then there are people that do steroids and don't do HGH.
Yeah. I'm not a big fan of either, but because honestly, I mean, depending on what your goals are, again, if we're getting back to this sort of wellness, like what can we do to help your body function at its best? I think most of that is accomplished with testosterone. Like you don't, if you're trying to win a bodybuilding competition, you might need to consider some anabolic steroids.
Yeah.
There's some people that use HGH as like a fountain of youth kind of drug. You know, I mean, that's not.
Yeah, somebody once told me it was like an anti-aging.
Yeah, but so is
potion.
Testosterone, technically. You know what I mean? Like,
Yeah.
it depends on what you mean exactly by anti-aging. So there's, I don't see the need, a huge need, and there's not a ton of data to support like that HGH does really anything special. And oftentimes I can accomplish for my patients what they want with testosterone alone.
Yeah, I mean, I started taking testosterone when, like, in my mid 30s or late 30s because I felt tired. I was like, I was a trainer then, so I was waking up early, probably going to sleep too late. And I think that probably was the thing that brought my testosterone to the lower normal level. And I just was like, I don't want to deal with that anymore. So.
I mean, it can become kind of a vicious cycle, right? Because if your lifestyle is such that you're not able to get good quality sleep, which is a lot of us, then your body stops producing testosterone as much, right? And then you don't have the energy or the motivation to, say, maybe go work out the way you used to. And then that affects your ability to kind of continue to produce testosterone. And so I often will tell people, especially guys who come to me and are like, well, I want to kind of do whatever I can naturally to raise my testosterone. Sometimes I'll say, okay, well, why don't you do this? Why don't you eat healthy? Why don't you get 6 to 8 hours of sleep? Why don't you exercise 4 to 5 times a week?
Never drink again.
Yeah. And then come back and see me in 3 months. And sometimes they'll be really good about it.
Yeah.
And we'll recheck their testosterone and it's maybe a little bit better, but not ideal.
Right.
And what I tell them is like, if we're going to start you on, one of these fertility sparing options, think of it as like the boost or the rev that you need just to get back on the horse, right? Like, I'm going to give you this little boost with this medication so that your T goes up a little bit so that you then have the motivation to do the exercise and can now have the hormone support to build that muscle so that your body can then start to produce testosterone on its own once we take you off the medication.
Well, can I share my story a little bit?
Sure.
I'm just going to I'll try and keep this very brief because there was really not a lot of guidance. I was about 32, 33. I was starting to feel a lot more like in my body. That's when I feel like I started feeling like a fit gay man. And when you're a fit gay man in the gay community, especially in Los Angeles, you want more of that. And somebody was like, oh, you should do this, and basically sent me to like this nutrition store where they had these random ass pills that were supposed to be for testosterone boosting. And I mean, even the labels on them were like printed kind of funny, but I was like,
was it Santa Monica Boulevard?
Yeah.
Right.
Yeah. But I mean, you can find them at a lot of these places. I'm not calling anybody out, but like the fact is, and as I understand it, they would be like legal for a little while and then they'd have to be taken off the market because they were illegal. They would change like one molecule and then put it back on the market. And, and I got a little bit of guidance where the guy was just like, oh yeah, you do this for like a month and then you take this as an estrogen blocker. And, I tried it for a little bit. I definitely saw some gains. But then there was this one day, I was in the middle of my week at Burning Man. I had done all the drugs, drank all the drinks. I was up every night. Like, it was like a Burning Man week. 10 years ago though, not today Burning Man, for me anyway. But I remember waking up and feeling a little lump in my chest and being like, what the hell is this? I thought I had breast cancer. I was so depressed. Cut to a couple months later, it didn't go away. I went to the hospital in San Francisco and asked them they basically gave me a mammogram. And even there, the doctor, she kind of was like, so it's not cancerous, but it is breast tissue. So whatever medication you're on, quote unquote, you should probably get off it. And I was like, medication? Like, I was like, Truvada? Nobody was giving me a straight answer. So I learned eventually that it was something called gynecomastia. We have a photo of it. It's not of me, but I wanted to show this photo just to show our users what kind of happens that is a case of that, right?
Yes. Yeah.
So this person looks clearly like they've done some artificial stuff. And there's a little bit, for those who are listening and not watching, there's a little bit of puffiness behind the nipples.
Like a whiteness around the nipple.
And it kind of protrudes.
It protrudes. It's puffy. There's definitely some tissue. And I've been seeing it, especially now that I've experienced it. I've been seeing it more. I've been noticing it. A lot of people who don't experience it don't even know what it is. And are less likely to notice it in others.
And it can be subtle. Yeah.
Is this more common than we talk about in our community?
I think so. Yeah. I mean, I see it a lot. It happens with people who are on regimens and may not be monitored. It's usually, by the way, it happens when your estrogen is too high.
Yeah. Tell us a little bit about like how that even happens.
So testosterone is sort of the building block for estrogen. Like your estrogen production comes from testosterone. And so if you are on something that's raising your testosterone and no one's monitoring your estradiol level, then that can start to have some effects on the body that estrogen does. And one of those is promote the growth of breast tissue.
Yeah.
So people will describe gynecomastia, and again, it can be subtle. Sometimes it's not something that someone can see, but it's something that they feel.
Yeah.
People will sometimes describe like an itchy sensation, like over their nipple, or like a burning sensation, or kind of like a discomfort, or even sometimes people will just say it feels more sensitive there. And then, other things, you can get hot flashes, right? Like estrogen can cause hot flashes sometimes if it's too high. And so when we put people on hormone treatments in my office, we're monitoring like a panel of hormones. We're not just like checking their testosterone if we're putting them on T, because we know that their testosterone will go up, but so will their estrogen. And you do need some estrogen. It's like important for your bone health. Again, it's sort of optimizing that number for someone.
And I'm guessing every person is different, right? You can't have like the same prescription for every person.
Exactly. There are some people, and people that used to do testosterone replacement therapy a lot because they were worried about gynecomastia. I'm talking about providers. Historically have put them on an estrogen blocker. At
the same time?
Exactly, yeah. Okay. And sometimes you do need to do that, but I've seen kind of a pattern from a lot of primary providers who I think just reflexively were giving people that. And then you have the opposite problem where I was seeing a lot of men who had very healthy testosterone levels, but like undetectable estradiol levels. And you would think, oh, that's good because I'm a man and I don't, estrogen is a female hormone. The reality is that, every body, all types of bodies have both testosterone and estrogen, just in differing amounts.
Yeah.
And for male-bodied people, like you need some estrogen for your bone health, and it's much more detrimental in the long term to have undetectable or too low of estrogen than it is to have, normal or even slightly high estrogen levels.
Is it true? Because I've definitely heard if you have like undetectable estrogen, it's harder for you to come.
So low estrogen levels.
I've never heard that.
I don't know specifically any correlation with like your ability to ejaculate, but I do know that low estrogen levels can affect in a negative way male sexual function, and we don't fully understand the breadth of that. I've seen it more in low desire. So again, you would think testosterone, that's like the only thing that's important for male sexual desire, but estrogen is also important. And just the same way estrogen and testosterone are important for female sexual desire. It's just the amounts are different. And so if I see somebody with low desire and they're on TRT and we do their hormones and we find that their estrogen is too low and they're on an estrogen blocker, we'll often remove that medication and they'll report improvements in their function.
Wow.
Yeah.
Yeah, so after a few years, I decided I was able to get an oncologist to take a look at me, and he decided he would just operate on me and got rid of it. I didn't touch anything hormonal for a little while after that. And then once I hit 40, a friend of mine who was a doctor, he was like, well, let's check your levels. And I was like, cool, under a doctor's care sounds much better than pills in a random ass nutrition store. So I did, and he checked my levels. He said, I was like at 350, which apparently is on the lower end of normal. Yeah. So he was like, so you are a candidate for it. Like we can get you on like a small-ish dose. I will say that the prescription he gave me was higher than what your office said was probably a good idea. Yeah. And I developed a little bit of it again, like just a little bit on the left side. And it's very interesting to me because, you know, I like asking questions about this to other people.
Yeah.
And I have a friend, he's probably listening right now. He's also a performer. And I was asking him about, because he came to LA to visit and he just looked built and beautiful. And he didn't look artificial, but he definitely, like, you know, he comes from skinny white boy, humble beginnings and like showed up like muscly and gorgeous. And I was like, well, what are you doing? And he was like, I'm on Tren, I'm on this, I'm on Deca. Like he named all these steroids that he was stacking on top of his testosterone regimen.
Yeah.
And I was like, well, aren't you worried about growing boobies?
Yeah.
And he said all confidently, he was like, oh yeah, but I don't aromatize.
Oh.
And I kind of was like, well, excuse me. First of all, Dr. Gonzalez, can you share with our audience what that even means?
If he doesn't aromatize, that's going to be a problem for him. But
Why?
Aromatization is the conversion of testosterone to estrogen, right? So there's an aromatase.
Hold on, sorry. The conversion of testosterone to estrogen.
Yeah, so your body makes testosterone.
Okay, yeah.
Right? Your testicle specifically makes testosterone. And then there is an enzyme that's kind of like circulating in your body that converts testosterone into estrogen.
And that's aromatase.
That is aromatase. Yes. So when people go on AIs or aromatase inhibitors, it's a medication that blocks that enzyme so that you can't get that conversion.
I see.
So that would be a major problem if someone didn't aromatize, which, by the way, there's not a test for that. So I'm not sure where that's
well,
coming
that's
from.
why I was going to ask, is it possible that he knows that for sure? Because I know other guys who have been on testosterone for like many years and they have none of these side effects.
That's the thing about hormone replacement therapy, right? Is that everybody is different. Like we have standard protocols for what we start someone on, but there are adjustments that we have to make. There are some people who are especially sensitive to increases in testosterone and will very much aromatize a lot of that and have problems, whereas other guys, sounds like your friend, may be using a bunch of stuff. And I mean, maybe he's not aromatizing because he's on an AI.
It could be.
Yeah.
I mean,
So-
but it's amazing that works for him. And whereas like I do this little meager amount of testosterone and start experiencing these symptoms.
Yeah.
again.
So I mean, your body
I've had it before too.
Have you? But it's gone. Mostly.
I mean, it. There are times where mostly it's completely gone. It's when I do something that I probably shouldn't.
But that's interesting. So when you're off whatever that something is, I'm not going to probe. It disappears. It just recedes.
No, I have to get something else to make it go away. I mean, I haven't had to do it that much, but
Okay.
Just like another medication, you mean?
An estrogen
like a
blocker.
tamoxifen.
Tamoxifen.
Oh yes. Okay. What is tamoxifen? What is different from? Is that also an aromatase inhibitor?
No. So that's I think it's a selective estrogen receptor modulator, I think.
Oh boy.
Yeah.
Doesn't happen to me just on testosterone alone.
Good to know. Okay. So I see.
Yeah.
All right.
Yeah, everybody's different.
So complicated.
I know. And
It's
I
like
probably
this is why I just want to
oversharing.
feel good.
This is why I have a job, right? Is that these things should be done, under the guidance of a physician.
I'm probably oversharing.
Oh no, I mean, like
We love
look at what
oversharing.
I'm sharing. Like, I mean, it just drives me nuts because like when I told somebody, when I started this TRT journey, people noticed I was also like being much more careful with my workouts and my diet, and I got a lot of comments. People were like, "Oh my God, you're looking great!" And when they asked me the amount of testosterone that I was taking in every week, they almost laughed at me.
Yeah.
Because they were like, "Oh my God, I do like 5 times that."
Oh yeah,
they're going for
my old trainer also like would dabble in testosterone, never from a physician, but he would always tell me like, oh, what do you like generally start people at, like how much testosterone per week? And I would tell him, like 100 to 200 milligrams, and he was like, what? Oh no, like when I was 18 I was doing like 600 milligrams a week. And
at 18.
yeah, I mean
that's probably horrible.
Yeah. Oh, go ahead.
No. So I mean, but
that just
he
reminded me.
also, like when he would be doing these cycles and we would be training together, like I would definitely notice when his acne would get really bad, and I'm like, and then he would be like, oh, my acne's so bad right now, and I'm like, well, I mean, you are doing a lot of testosterone, so there are consequences to things that you do.
And I heard, because I didn't do anything until I was in my 30s, that like you should not dabble in any of that before your 30s.
Yeah. I mean, I think
Yeah.
that it's mostly that is when your testosterone starts to naturally decline,
Yeah.
right?
Would you say 30s or 40s?
So it's used to be like after 40, we would say about your testosterone would decline about 1% per year, but that seems like it's like going closer to like 35. So it happens pretty early. I mean, again, like think from an evolutionary standpoint, right? Like our bodies were not really made to last beyond years of procreation.
We live too long.
Exactly. Yeah.
Thanks, Obamacare. Well, I mean, what you're saying, Cole, is interesting to me because it reminds me that a lot of the guys that I know who are between 30 and 34, if they tell me they're interested in increasing their testosterone, these are guys who usually are in pretty good shape and are just around a lot of hot gay guys.
Yeah. Yeah.
This is kind of a thing that is like symptomatic of our community a little bit.
Totally. Yeah.
You know, I love a fit man.
Yeah.
For sure. But like I always kind of tell them like, listen, you're 31. Like you're good right now.
Yeah,
wait till you're older before you start messing with how the endocrine system works.
Yeah. And then, I mean, a lot of guys, especially in our community, don't understand the impacts that it can have on things like fertility, right? And I've seen even providers put gay men on testosterone replacement therapy without even having a conversation about like, hey, do you want to have kids at some point in the future? Just assuming, oh, they're gay, they don't want to have kids. And it basically shuts down your sperm production. And if you do want to have a child biologically from your sperm in the future, depending on how long you've been on testosterone replacement therapy, it can be incredibly hard to undo that. And sometimes it's not reversible. So there's this kind of, community pressure to like look a certain way. And a lot of guys, I think, want to go for the quick, easy fix. How can I look better? I'll just go on testosterone replacement therapy without really thinking, how is this going to affect my health in the future?
Right.
So
this is something you offer to bring it back full circle. This is something you offer in your office.
Yeah. It's physician prescribed, physician monitored, so that we're not seeing problems with gynecomastia. We're not seeing, a lot of the other issues that can happen when you're using too much or not using the right combination of things.
Right.
Going back to that analogy that I gave of like the thyroid problem, right? Again, if a doctor puts someone on a thyroid medication, there's some titration, there's some adjustments of dosing that have to be done. They usually see them back a month later, 6 weeks later, check their levels, check in on how they're feeling, and adjust what they're doing.
Yeah.
And I think to me, it doesn't make sense why we don't treat testosterone like that. So when I put someone on a treatment, they have a 6-week appointment to see me. If they're experiencing any side effects during that 6 weeks, we tell them to call or email us. But we're checking in with them 6 weeks later to do some blood tests and see where their levels are at, and also see how they're feeling, and kind of trying to match their levels and optimize their levels so that they feel the best.
Yeah. Other than that, we also there's another thing that you offer that we've been kind of both exploring. It's called Shockwave Therapy.
Shockwave Therapy.
Shockwave Therapy.
And I have to tell you, I've done 3 treatments. My last one, I did it like exactly a week apart for the first 3. The next one, I'm taking 2 weeks before my next one because I just couldn't. And I woke up yesterday with like a trimix boner without any trimix.
You're welcome.
I was like, and today actually, I was like, I almost texted you, and then I was like, no, this is good for the show.
Yeah, the morning wood thing was definitely a noticeable thing. Do you want to tell our listeners what shockwave therapy is?
Yeah, so it's I don't love the word. It makes it sound like a painful thing. So sometimes we refer to it as sound wave therapy, or soft wave. But it's basically an energy-based therapy. Kind of looks like a big ultrasound probe.
Yeah.
That we put on your penis, delivers a shockwave, which is a specific kind of sound wave, and that energy gets absorbed by the erectile tissue, which then release growth factors, and that promotes new blood flow to the area. It can also help improve scar tissue that you may have acquired over the years of using your dick, and so it can help fix some scarring and just make it basically improves the function of your erectile tissue. And one of the first things that people who do the treatment notice is more morning erections, more spontaneous erections, or when they are having sex or masturbating, that they get harder easier, or they're able to maintain their erection with less work. Yeah. So it's a treatment we do in the office. We usually recommend 6 treatments over the course of 6 weeks. And it's a really cool thing to offer that it's kind of a new tool in our toolbox in the last, I would say 5 years, that we've been able to do that's regenerative. Most of the other treatments that we do are, things that we prescribe to try to fix a problem. And Shockwave can do that. Shockwave can help improve function or reverse problems with your erectile function. But we've been using it a lot more as a preventative therapy. So guys who are not already having a major problem with their erections, but who want to just perform better and just feel more confident, essentially, when they're having sex.
Yeah, optimize.
Yeah, again.
And spontaneous, or what I like to call them, ghost erection.
Ghost erection? What's a ghost erection?
A spontaneous erection, like a ghost was rubbing your cock.
I love when that happens. This kind of goes back to how we started this episode. Because I've been noticing a definite change. I'm ahead of Cole in my treatment in that I did the 6 weeks already. And the other day I actually was having some issues, but it happened to be on a day that I was hungover and dehydrated. Mm-hmm. And I was like, oh no, I can't do this again. Yeah. Because my Shockwave's not working. So I cheated and used Bimix, and it was great.
Yeah. So, the thing is it's not like a magic treatment, right? It's not going to make your dick like it was when you were 18. If it could, I would have a line outside, down the block.
It's more subtle.
It's more subtle, and it's meant to be part of another way to optimize your sexual health, right? So same thing with testosterone. We put people on testosterone and we do Shockwave treatments, but that's meant to go along with other healthy lifestyle choices, right? So it's not surprising that you can't perform if you feel hungover and you're dehydrated and you're tired.
I know.
You're not 18 anymore, unfortunately.
I certainly
we used to be able to do it, but the body doesn't work that way.
Right.
So this is meant to just be part of one other aspect of trying to optimize your overall health.
Yeah. I'm actually going to be meeting up with a friend of ours who is seeing you for something I had no idea you did, which is a vasectomy.
Yeah. Yeah.
That's something you also do?
That is, yeah. So urologists are we have a lot of tricks up our sleeves.
So apparently.
Yeah. So we're essentially sexual and reproductive health providers. At least the people that go into kind of men's health. They're urological oncologists that deal with cancer, and pediatric urologists, and incontinence specialists. I don't like any of that. I just rather keep it to sex and fertility. But yeah, so obviously the one aspect of reproductive health is deciding whether or not you want to have kids in the future, and the most reliable form of contraception is vasectomy.
Wow.
And so yeah, that's something that we do.
Fascinating.
Yeah.
God, I could keep asking questions. Is there anything we left out?
I don't know.
Is there
honestly, we'll just have you back.
Yeah, we're gonna have to keep
we'll just
having
make it
you
a
back
tradition
because this is just a topic that is just too important.
Or if you get questions from your listeners, just we'll write them all down and we can do a Q&A.
That's actually a great idea.
Yeah, right now we have an email that you can submit questions to. It's
sorryforAskingPodcast@gmail.com.
It's just a Gmail because I tried to do another one and I'm not good at stuff like that.
No,
so
it's Gmail. That's fine.
Yeah, it's weird. It's a weird one. So I have to fix that.
Please, you can DM us on Instagram. You can reach out to us on our X accounts, or you can send an email to sorryforAskingPodcast@gmail.com. Ask us any questions that you think we should have for Dr. Gonzalez next time.
Yeah.
And in the meantime, Cole, do you have anything else?
I don't think so. I've got to pee like a racehorse.
All this talk about dick health.
On the water.
Well, we have an incontinence specialist right here.
Oh, God, no. Now he hates he's an incontinist.
I know, I'm kidding. All right, well, Dr. Gonzalez, thank you. You're a magician, and we love you. We really appreciate having you back for our second health segment.
Much. Anytime.
This is amazing.
Thank you.
And thank you all for listening. Thank you, Cole.
Thanks, Cole.
Thank you.
I'm Adam Ramzi.
Thanks, Adam.
I'm Adam Ramzi.
I'm Cole Connors.
Sorry for asking.
Sorry for asking. This has been Sorry for Asking.
Be sure to like, comment, and subscribe.
And until next time, stay sexy.